Okay, these next positions that I wanted to talk about would be where I was ventilating the patient from up above the head. And I would be in this position for a couple reasons. One, if there was a second rescuer. So somebody would be doing compressions here, me being the second rescuer. If I was ventilating, I would be up above the head. The other time I may be up above the head ventilating is if I was rescue breathing. Okay, and we'll talk about that in a minute, but that's where our patient actually has a pulse but is not breathing. I could be up above the head ventilating. So let's talk about that. This position here requires me to use a different hand technique. Okay, we're still going to do a head tilt chin lift, but it's slightly different. So instead of using this C grip, which we talked about before, where if I was on the side of my patient, okay, we'd use this little grip like this, head tilt chin lift. What we could do from this position here, okay, up above, we put this mask on them, and it's going to look like this. I basically do a kind of double CE grip on them like this. These fingers here go on the jawbone. These fingers here hold the mask to the face. Okay, these fingers here are on the jawbone, not up under this soft tissue. We never want to grab up under that soft tissue. We're always up on the jawbone there. So it would look something like this. I'm using the heels of my hand to do my head tilt, and these fingers here on the jawbone doing a chin lift. So from this position up above the head, take these fingers here like this, okay, head tilt, chin lift, and then I'm going to ventilate from this position. 1 breath, 2 breath. And that would be for a mouth to mask ventilation from up above the head. Now the other tool that we could use is this is called a BVM, it's a bag valve mask. Okay. So I could do essentially the same thing, but instead of using this double CE grip like this with this mask, from here I kind of have to use a single or a CE grip. Same thing, we're going to put our fingers around this mask here. The mask goes on up above over the bridge of the nose, and make sure that it's completely sealed around the cleft of the chin. These fingers will go over the mask like that, and so it'll look like this here. These bottom fingers here will grab the jawbone or mandible there, not impinging on this soft tissue, but up here on the jawbone. So we push down, head tilt, chin lift, and we're going to go ahead and ventilate. So what it would look like from here, I get down at head level, put the mask over the bridge of the nose, completely sealing it around the cleft of the chin, head tilt, these fingers are here up on the jawbone, and then I'm watching for chest rise and fall. 1 breath, 2 breaths. And you'll notice I'm not ramming air into them. Okay, it's a nice, easy flow. I have a good seal here, head tilt, chin lift, and 1 breath, 2 breaths. And then my partner would continue with compressions.